Good morning, good afternoon, good evening. This is Dr. DeShavo. Wherever, whenever you might be with me is fantastic. I hope that the class is going well for you. And of course, as always and forever, you got it. Shoot me an email if you have any questions. We're moving into musculoskeletal function, which is one of my favorites because I'm a chiropractor. So really enjoy this one. This is a fun one to teach. Of course, I could teach you 10 times more than we're going over, but I tried to limit it down to the basics that you need to know. And the better you know the anatomy and physiology for this, the easier it is to diagnose things because it's fairly, I don't want to say straightforward, but if you know the structure and the function, you can denote what kind of problems can happen with the musculoskeletal system. So the musculoskeletal system is obviously going to be muscles, skeletal muscles, because don't forget there's cardiac as well as smooth muscles as well. Skeletal muscles will be voluntary muscular system that moves us through space. It'll include the joint or the bones that it's connected to and the joints that the muscles and the tendons cross. So a tendon connects muscle to bone. Tendon connects muscle to bone. A ligament connects bone to bone. So a ligament will be quite often found in highly movable areas. If you think of the foot, there's a lot of ligaments. The pelvis, there's a lot of ligaments. Not that the bony pelvis moves a lot, but the legs move a lot to move us through space. There's also other connective tissues like an aponeurosis. If you're dying to know about those other connective tissues, we can talk another time. But once again, I'm trying to keep it to the basics. And even with the basics, we have 110 PowerPoints. So could be a lot more. If you do want to see more, you can always go to my YouTube channel and watch my A&P for the muscle system, and then the skeletal system, and then the joint system. I actually have 3 weeks of lecture for that. But anyway, I'm going to review the basics, which hopefully you remember, and then we'll move into disorders. So we're going to talk about and look at compact bone and spongy bone. I'll show you a picture. I'll describe it to you because the function of that's much quicker and easier to understand with visuals. There's multiple purposes for the musculoskeletal system. I think initially we think, oh, okay, it moves the body, right, and supports the body, but it also helps to protect organs. It stores calcium and other minerals such as phosphorus and magnesium, and is a site for hematopoiesis, which is the creation of red and white blood cells, which we reviewed in blood. So we're going to break it down into separate units. We're going to do the A&P, very basic physiology of the skeleton, joints, and muscles, and the anatomy of each, very basic of anatomy of each. But we're going to break it down to skeleton, then joints, then muscles. So let's get moving. You should remember these bones, I hope. If you don't, please review them. And I didn't even give you all of them. These are all skull and jaw bones. Frontal in the front, parietal is the top of the skull, temporal is at the temporal bone near the ear. There's also occipital at the base in the back. It may sound familiar, but it's not on this list, so I won't make you responsible for it, but you should know it. I'm wagging my finger right here. Okay, so the maxilla is the upper jaw and cheekbone. The mandible is the one that everybody loves to move down like the skull is talking, the mandible. And the mandible is good to know for temporal mandibular disorder, with the jaw pain with clicking in the jaw, which is actually not in here, but that's a good thing for you to know. The shoulder girdle consists of the clavicle in the front, which is your collarbone. I always remembered C and C, and the scapula in the back, or the shoulder blade. They both begin with S. You all know humerus, radius, and ulna. I think you're all good with that. Carpals are the small wrist bones. Metacarpals are the long bones of the palm. Phalanges are your fingers. You can also call your toes phalanges. And then we have metatarsals, which are the long bones that lead out to the phalanges of the toes, and tarsals create the ankle bones. I'm thinking these are probably familiar, Your leg, got it, right? Femur, kneecap, patella, tib, fib, and your shin. Fibula is lateral. Okay. I'm sorry, excuse me. And don't forget that radius is lateral in the forearm, but you probably know that for radial pulse. Now, the bony pelvis begins as 3 bones. And this is why we have multiple names for what seems to be one bone, is because it will begin as separate bones. When we talk about the fetal skeleton, it starts as cartilage. Over time, that cartilage starts to harden or ossify with calcium, phosphorus, and magnesium, but it does it in a very specific way. The bones will start to harden. So if you're looking at the pelvis, it begins as 3 separate ossification centers, or areas that cartilaginous matrix or the cartilage will turn into nice hard osseous bone. And with the pelvic girdle, you have an ossification center that begins about here in the back, and then about here in the front. And of course, it would be on both sides. For example, this upper one, these 2 areas would ossify at the same time, right? The 2 back areas would ossify at the same time. The 2 front areas would ossify at the same time. So that way you have balance between those ossification centers. So because it begins as 3 different locations, of course we're going to make it harder and make it 3 different names. And that's where you get the ilium with the iliac crest. Let me erase this. The ilium, which includes the back of the bone, including the iliac crest, which you should be well familiar with. The ischium, which are the hard bones that you sit on underneath here. And then pubis is easy because that's where the pubic bone is. And once again, I'm assuming you remember the parts of the pelvic girdle. If you don't, I'm waggling my finger, go back and review. Tailbone is sacrum and coccyx. I think everybody's familiar with that. Sternum, you could just know sternum if you know the separate parts. Fantastic. You probably know angle of Louis or sacral angle to get your heart sounds. And then the ribs. We'll just go with ribs to keep it simple. And that is the skeleton in 2 minutes or less. Very basic. So, bones, talking about the actual structure of the bones itself on the inside. It's actually a form of connective tissue. It functions as a site of fat and mineral storage, which we know as well, and a site for hematopoiesis. There's 206 bones in the skeleton, but some people actually consider what are called sesamoid bones, which I'm going to talk about in a couple of screens, as the additional bones. And we all tend to get these sesamoid bones, and they're just hardened areas in ligaments or tendons. They tend to form in areas where we have a high amount of wear and tear. So some, like I think it's podiatrists, that really consider there to be 208 bones in the body because there's 2 sesamoid bones that people tend to develop in their feet. Whatever. I'm just totally went off road with that. I'm sorry. Let's go with 206. Done. Okay, skeletal division. So there's 2 main divisions. There's axial, just like our Earth has an axis about which it rotates. The axial skeleton is going to be the skull, vertebral column, and rib cage. Appendicular will be the shoulder, pelvic girdle out, including the arms and legs, just like we're talking about appendages. So, if we go back one slide, axial skeleton is skull, vertebral column, really sacrum and coccyx as well. You should add in there. The ribs, okay, all these ribs, that's all axial skeleton. Appendicular skeleton is the shoulder girdle, which consists of the clavicle and the scapula, here and here, the upper extremity, the pelvic girdle, which is the bony pelvis, and lower extremity. So that would be appendicular skeleton. The cells that break down and build up bones are listed here. Osteoblasts build bone. I always remembered B and B. Osteoblasts build bone. Osteoclasts break down bone. I didn't really have a way to remember that, but it sort of in my mind sounded like clamping together. Osteoclast, you're clamping together like jaws and you eat down that bone. And you're going to want to have a balance of both, right? You want to have osteoblasts to build that bone so we have nice strong bones, but we also use osteoclasts to release calcium, so we're able to use that calcium for cart and muscle contraction. Osteocytes are mature bone cells that help to maintain the bone matrix. Don't worry about them releasing calcium into the blood. I don't want to confuse you. Osteoclasts are the main ones that help to break down the bone matrix so we can release calcium and phosphorus or phosphate into the bloodstream to be used by other tissues of the body. I know why they did this. So, never mind, go with that. If you want to know, shoot me an email. I'll tell you the actual difference between them. Okay, so if we look at this, this is a long bone, and the long bone is really the only bone that we're going to look at the separate parts of. We have long bones, we have short bones, we have irregular bones. Okay, we're just going to go over the main structures of long bones because really, frankly, it's the most important one to do. But if you look at the long bones, on the outside we have what is called compact bone. And it's just that. It's bone matrix that's compacted together to make a nice, strong tissue. On the inside we have spongy tissue, and thank God for once it makes sense. It's called spongy because it looks like a sponge. And in this spongy tissue we can put yellow or red bone marrow. Usually in this bone, which is the proximal femur, although it looks kind of weird to me. Anyway, in the proximal femur, in the spongy area, is where we'll make red marrow. Over time, we start to put more yellow marrow into the center of the bone. But I'll show you a picture of that as well. Now, here's a picture of compact bone. I'm not going to get into the microscopic aspects of it, but you can see how tightly that tissue is packed. And in this tissue, I do want to remark that we have osteocytes, osteoclasts, osteoblasts. We have our calcium matrix with calcium as phosphate and magnesium. We also have a lot of blood vessels. And if you look at these central portions, every one of these has a blood vessel. It's called the Virgin Canal. You may remember it from A&P. And then from that central portion to each one of these round circles will send blood out to that tissue. So bone is very vascular. People get a little confused sometimes when they think it's not. It is really vascular. And an easy way to remember that is if you break a bone, you can repair it very easily because of the blood supply to it. When we're talking about ligaments, tendons, and cartilage, they don't have a direct blood supply. They get their nutrients through diffusion through the surrounding tissues. That's why if you tear a ligament, tendon, or cartilage, you need to have it surgically repaired. But bones are very vascular. They have a direct, intricate blood supply that we can use if we're talking about a reparation or repairing process, I should say. Classification of long bones, don't let it blow your mind. We're going to go over a little bit of the structure of the long bone, which will be your femur, tip fib, humerus, radius, and ulna. But we also have flat bones. We have irregular bones. We have short bones. And they pretty much go by their names. And you can see long bones there. And then you can see short bones, flat bones, irregular bones, sesamoid bones, which are the ones I explained to you that are embedded in a tendon. So just know in general those names, because other than the long bone and the sesamoid bone, which have specific parts or descriptions, the other ones are exactly how they sound. Okay. So a sesamoid bone, once again, will be embedded in a tendon, or really it could be a ligament as well. Just make note of that. And then long bones are going to be the long bones that are longer than they are wide. They're going to have growth plates at either end. And that's an important thing to know about long bones, because what that growth plate does is allows the length of those bones, right? It's horrible. I can't draw very well. So with long bones, you'll have a growth plate, and of course this should be rounded. Oh, that's horrible. I apologize. Anyway, they'll have a growth plate at either end, and that allows it to grow this way as well as this way to maintain the structure of the long bone and allow that long bone to grow longer. So the outer part is compact bone, which I showed you, and spongy bone on the inside. But I also want to point out that at the end here, there's cartilage on the ends of these long bones, because every one of these long bones touches another long bone, or it could be a short bone or some bone of some type. And the cartilage on the end allows it to be cushioned and to protect the long bone. And then generally you'll also have a synovial capsule, which is cartilage. I'm sorry, I apologize. And then synovial fluid, creating a freely movable joint, which we'll explain in a little bit, but I thought I may as well go over it while I'm here. A freely movable joint that gives us a huge range of motion. Okay, so here's those other bones, and that, my friends, brings us to a question time. So, skeletal bones are only in place to support the body and create movement. True or false? Please answer that, and then pause it if you have to, and let's move on. So, look, I could have just looked at the picture here. I apologize. Here's your long bone. And the growth plate will be between what is called the epiphysis, which is the end of a long bone. E and E, epiphysis, epiphysis, ends of long bones. So your growth plate or epiphyseal growth plate, you can just say growth plate, will be between those epiphyses and the diaphysis. I'm just switching between plural and singular. You won't have to worry about it. On the outside, we have that nice compact bone. On the inside, we have spongy bone, which creates a marrow cavity, which may have red marrow in infants, most likely yellow marrow in the diaphysis in an adult. And here's a nutrient vessel, which shows us that it has a good, strong vascular supply. Now, on the ends is your hyaline cartilage, just on these ends here where the joint cavity would be. And you can see some hyaline here as well in the blue. And those help to protect the ends of long bones and protect them in that joint cavity. And that's an important thing to note, because those will be broken down when we get into arthritides or arthritis. The final thing I want to talk to you about on this picture is the periosteum. The periosteum is an irregular connective tissue that's on the outside of these bones, any bones that we have. And the reason that I want to point that out is it is slightly vascular. It is vascular, but it is also innervated, which means it has a strong nerve supply. When somebody has a lot of pain from a fractured bone, it's the ends of this periosteum at the fracture. The two opposing ends get separated. And when they get separated, they can actually rub up against themselves or other structures if they're not approximated, and that's what triggers the discomfort with fractures. I also had a patient years ago who had gotten severe back pain when she was lifting a window up. Anytime you have that compressive force through the spine, you want to think fracture. And there was an old trainer trick where you take the tuning fork that has the round ends on it. I don't know the vibration, but you all know what I mean from your tuning fork, from your diagnostic bag. If you take that and put it to the area where that patient says they have discomfort and pain, if they flinch, it's because the two ends of the periosteum rub up against each other in a compression fracture. And I'll be darned, that little old lady, I couldn't convince her to go get x-rays because it was fish fry Friday. She wanted her fish fry. Okay, so I said, listen, this is an old trick that I learned. And if I put this on you and you flinch, you're going to have to go to the emergency room or urgent care. And I put it on there and she flinched. Not does she just flinch, she was off the table in pain. She indeed had a vertebral fracture. She ended up going either to her doctor or urgent care or the emergency room. I don't remember. It was 15 years ago. But she indeed had a compression fracture. So tools of the trade, if you think somebody has a fracture, you can use that tuning fork, put it right over, and it'll rub that periosteum against itself. Little fact might help you to help somebody in the future, hopefully. Now, looking inside, we've got the blood vessels, which we spoke about. I'm not going to, well, you could know that the blood vessels travel through these Haversian canals. Remember I told you the blood vessels run through the center of the circles in compact bone right here. Okay, that's called a Haversian canal. That's where the blood supply is. And then in compact bone, we have these concentric circles forming the microscopic, this is all microscopic appearance of that bone, of compact bone. So in the inside of spongy bone, we could have red marrow, which tends to be in the proximal ends. And I'll show you a picture of red marrow and its location in the whole skeletal system in a few slides. Or you could have yellow marrow. It depends on the maturity of the patient and the location in the bone. In general, if you have to guess, yellow marrow will be in the shaft, red marrow will be in the ends, but you'll see it changes as the age of the patient increases. Okay, so bone marrow could be at the ends, could be in the shaft. Generally, the shaft will be yellow, but once again, that's just a generalization. I have in the next picture, you'll be able to see. Red marrow is going to be the site of the creation of red and white blood cells. In an adult, the creation of red and white blood cells will be in the vertebra, pelvis, skull, scapula, ilium, specifically with the pelvis. So let's just look at a picture because I think this clarifies it here. So this is red marrow in an adult versus a child. And you can see with a child, they're going to have the whole skeleton is going to be a site of the creation of red blood cells and white blood cells when they're young. In an adult, over time, yellow marrow takes over those appendages, legs, and arms. And the proximal skeleton, the axial skeleton, the pelvic girdle, and the shoulder girdle are going to be areas of red bone marrow. I think the areas they most likely will harvest will be ilium and scapula. For that, now when it comes to stem cells, I'm not sure where they would draw that from. So I'll look that up on our next break and let you know, because I bet you when they're harvesting either stem cells for the injections or for, they're doing a lot of things with stem cells for surgeries. They're also injecting them into joints to help the joints function a little bit better. I'm not sure where they harvest that from. So I'm going to look it up on the next break and I'll tell you the beginning of the next break. All right, so moving on to the bone matrix, I think a really important thing to remember with the bone is the bone starts as cartilage. So not only does it start as cartilage with the fetal skeleton, and then they get ossification centers in the bones, which eventually makes the bone nice and hard calcified matrix. It also is the precursor to hard bone in our skeleton. So collagen is an important precursor to the hard skeleton. So it's important to have the nutrients to support that collagen. And vitamin C is one of the main ones, just so you know. If you don't have the proper amount of collagen as a precursor, you also won't have enough bone matrix. So calcium phosphate crystals, and there's other crystals we could talk about as well, but this is the majority of it, are deposited in that collagen, and that makes the bones hard and strong. So it's a double whammy. You got to have good collagen, you got to have good calcification to create that optimum bone function and structure. So bones will grow in two ways. Appositional growth is when new bone will form on the surface of a bone, which generally will make the bones thicker. As we all get bigger, we get bigger boned, and that's why we can't lose weight. right? I'm just joking. A little bit, but really not really. As we get older, your bones just get wider. It's part of the growth process. And that's why people's faces and their body shapes change as they get older. But it's not a huge, huge, huge amount. Endochondral growth is when the bone eventually replaces new cartilage growth in the epiphyseal growth plate. And this lengthens the bones in the young. But this will stop generally between 18 to 21 for everyone. And that's when we stop growing height-wise. The epiphyseal plate is your growth plate that I mentioned that's between the ends of the bones and the shaft, also known as the diaphysis. So proper nutrition is super important, but they're also finding that physical activity, especially weight-bearing activity, is very important. That stress on the bone actually allows the deposition of more calcium phosphate into the bone to make it stronger. It's the body's natural response to weight in the bone. And we know already that we need calcium, vitamin D, magnesium, and phosphorus to put the calcium into the bones, and also to get calcium out of the intestines with vitamin D. Growth hormone works with thyroid hormones to control normal bone growth. And we spoke about those hormones previously. We spoke about calcitonin, putting it in the bone, remember, right? And parathyroid hormone to regulate bone breakdown. So we spoke about those before in endocrine. If you have any questions, let me know. Otherwise, I'm going to move on. So don't forget that estrogen and testosterone will also help with the deposition of bone. So estrogen, or it prevents the breakdown of bone, especially with estrogen. So estrogen inhibits osteoclasts. Osteoclasts break down bone. Remember, it chomps it up. So if estrogen inhibits osteoclasts, it stops the breakdown of bone and it allows our bones to be stronger and healthier. This is why when we undergo menopause and we have less estrogen, those osteoclasts are more active, which breaks down bone, and it causes osteoporosis. Now, testosterone kind of has a double whammy here. First of all, it maintains bone strength. So in males, because they have a higher amount of testosterone, their bones tend to be stronger. Not in all cases, we're talking about generalities. But testosterone also increases bone length and density in men, making them, in general, bigger than females. And that's why males across the board are bigger than females. Don't forget, vitamin D will absorb calcium from the intestines and reabsorption from the kidneys. The skeleton, don't forget, starts as hyaline cartilage during fetal development. Cartilage is tough and flexible connective tissue that has multiple functions in our body. So not only does hyaline cartilage form almost the entire skeleton, and then we will harden it with calcium phosphate to make the nice bony skeleton. Some of it is left over. Hyaline can be found in your nose, at the ends of long bones. It can also be found connecting the ribs to the sternum. As opposed to fibrocartilage. Fibrocartilage, when you look at them microscopically, is an entirely different tissue. Fibrocartilage you can always think of as discs. Anywhere in the body that we have a cartilaginous disc. We have discs between the vertebrae. We have discs in the temporal mandibular joint. We have discs in the elbow and the knee, the menisci. Anywhere you see that you have a disc, you'll have fibrocartilage. Elastic cartilage is easily remembered because it's found in the ears and the epiglottis, E. So if you were to look at microscopically the cartilage in the ears and the epiglottis, it's going to be that elastic cartilage, and it's known as such because it has more elastic fibers. My little guy, who's 8 years old, can pull his ears way out and they snap right back. And that's a great example of elastic cartilage allowing flexibility, but that elastic fiber that is located in it microscopically allows those tissues to snap back into shape. Now, my friends, that brings us to a little let's practice. I thought this would be fun. This might be a little hard to see, so you might want to pause it and look at them, especially the upper one is a little hard to see. and the lower ones. And I have a trick question here, so don't just jump. So pause the tape if you need to. Otherwise, I'm going to answer this. This top one, what bone do you think this is? Look at it very carefully because it's kind of pointing to the back. And I don't mean the ribs here. It looks like the ribs. I mean the one in the back. That is the scapula. Very good. I'm guessing. This upper arm bone, you get this. That's humerus. This one's a trick. This bone correlates to the thumb. You're like, got it. Radial pulse, right? Radius. This upper, I shouldn't even have tested you on this. That's too easy. Femur. And last but not least, the shin bone is going to be the tibia. And the fibula is the outer one. And just make note of that. The fibula is actually not weight bearing. It's only the site of attachment for muscles and tendons and ligaments. That brings us to about half an hour. So I'm going to take a break. Go ahead and grab a cup of coffee and let's continue in the next video.